Hi guys, we have a case of a 65-year-old female with left lower quadrant abdominal pain. Let's start quickly going from top to bottom, looking at every organ briefly, and then after finishing that, that's when I like to follow my search pattern. Let's start with the lung basis. Some atelectasis in the lung basis. I didn't see pleural effusion, pneumothorax, or consolidation. Quick look at the heart and the pericardium. The pericardium looks okay. I didn't see anything concerning inside of the ventricles that represents thrombus. Quick look at the liver, nothing concerning. There is cholecystectomy clips, so this person had their gallbladder removed. Pancreas looks okay. Right and left kidney, I didn't see a big hydronephrosis or a renal stone. Then usually I like to go to the right lower quadrant in the area of the appendix. We actually do see the appendix really well, and this is a normal appearing appendix. Quick look at the ball loops. They're overall normal in caliber. I go down, look on this general area, and I do see fat stranding in this area. Now, my top thought is that could this be a diverticulitis? So let's follow our colon from the bottom. A rectum, sigmoid colon here. And as I come up, so the colon itself looks normal. Maybe there's slight wall thickening right here. This abnormality seems outside of the colon. Let's look at it in coronal and sagittal. So this is our loop of sigmoid colon, and the abnormality is situated outside of the colon. There's this fat density structure surrounded with some inflammatory stranding. Let's look at this in sagittal view as well. So this is the right side with the appendix. We saw that on the left, right here. So it seems to be coming out of the, it's abutting the wall of the sigmoid colon, a fat density structure with surrounding fatty stranding. And this is a classic look for epiploic appendicitis. What epiploic appendicitis is, there's this one YouTube video I found. So colon has these epiploic appendices on the anti-mesenteric side. Anti-mesenteric side just means that the mesenteric side is the side that's attached to mesentery where the fat, where the mesentery and the blood vessels come in. On the opposite side, there are these epiploic appendices, and sometimes they torse on themselves or have, I think it's like venous occlusion, and that's what leads to epiploic appendicitis. It's a self-limited condition. I think people give NSAID for treatment, but this is a non-surgical case as opposed to appendicitis. Usually happens in the sigmoid colon or on the descending colon, but sometimes can happen on the right side and mimic appendicitis too, but a self-limited condition. So that was this case. And right here, I saw this true structure. I just want to point out these are the ovaries, the right ovary and the left ovary, and they're just on both sides of the uterus. So this is not ascites. And at this point, I'll just go to the top and follow my source pattern down to look at everything. But the diagnosis in this case is epiploic appendicitis. Thank you.